Well, welcome to the Daily Brief on Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, President of the MMAC, and in a moment, I'll introduce Dr. Raymond, President of the Medical College. Each day at 3:30, powered by Aurora WDC, you're going to join us for a fact-filled 15-minute update to address COVID-19 and its impact on the health and the economy of the region. So thank you for joining us, and I'm going to jump in and start with a healthcare update from Dr. Raymond, President of the Medical College. Dr. Raymond?
Thank you, Tim. What we hope to accomplish this week with these brief updates is to focus in important ways on different information that can be current. So today what we'd like to do is introduce the concept of what should we be looking at to measure how effective the Safer at Home initiatives and other interventions have been. And remember, any intervention that we do may not be measurably effective until at least a week out because of the asymptomatic nature of the disease. There may be people that are in the pipeline that are not already influenced by any interventions in real time. So I want to tell you, one of the things that we're going to be providing to you every day is a current growth rate of the number of positive cases here in Wisconsin. It's an imperfect measure, but I think it's one that has been used in other communities and that which we can benchmark not only our performance against previous history here, but against other municipalities and countries. So last week, our growth rate was tracking at about 30%. It appeared to have slowed over the weekend, but I don't want to get too optimistic yet, mainly because reporting probably has not caught up with all of us yet. But we went ahead and calculated a rate, which I'll share with you a little bit later on in the conversation. Another critical point is the doubling time, which basically is an integer of the rates that we have projected out into the future. And this is the rate that I'm going to report daily that will help us to calculate, in part, when our health systems in the region might reach capacity. It's a very simple measure, and I know many of you are aware there are other trackers out there to look at health system capacity and when a surge may end in a community, and we'll be happy to talk about those as well, but we want to focus again on the daily growth rate of new positive cases in Wisconsin and Milwaukee, and then the projected doubling rates. So as of today, we're still projecting the third week in April for there to be a saturation of the healthcare beds in the state, assuming that we continue to track along the course that we had last week. And again, the most important figure will be the doubling rate trend, which we'll be able to show you at the end of the week as we compare last week's numbers with the numbers this week. So as of today in Wisconsin, there are a total of 1,221 positive tests with 109 new positive tests. The current doubling time is about 3.9 days. So that would appear to be better than last week when the doubling time was right about 3 days. In Milwaukee County, we have a total positive tests of 663 with 38 new positive tests. That gives us a doubling time of about 3.7 days and a daily growth rate of about 19%. So comparing the daily growth rate of 18% for the state and 19% for Milwaukee, that sure looks better than last week when we were experiencing 30 to 35% rates. But again, we really won't be able to know whether this is a real trend or a reporting artifact until tomorrow because of the lag time in reporting the positive cases over the weekend. And in some cases, that doesn't happen until the healthcare provider and the individual with the positive test have been notified. So that, again, maybe we'll have some optimistic news later in the week, but let's be concerned that there might be reporting artifact today. And I also wanted to just touch briefly on what we're seeing on the near north side of Milwaukee and now the south side with two so-called hot zones emerging on the near northwest and the near south side in predominantly African-American and Latinx communities. We really don't know why there's an increase that started there. although it may be travel related for some key individuals that interacted early, and the health department is looking into some of the root causes. What we do know is that the most important actions individuals and organizations can take really have to do with social and physical distancing, and we've already spoken at great length about that, and I want to reemphasize that right now, irrespective of where an index case came from or where the infection came from, we need to focus very much on every community and trying to make sure that we practice physical and social distancing. And what I want everybody to expect is that over the next few days, those nodes will spread, coalesce, and really grow over the entire Milwaukee region. Later this week, we'll give you updates on the key metrics that we talked about today, and also talk about some key questions that you've been asking us about testing protocols, new methodologies for testing, and shortages of critical reagents in the testing pipeline, the progress on developing vaccines, and then potential drug therapy solutions. So with that, I'll stop and turn it back over to Tim.
Thank you, Dr. Raymond. And before we kind of move on to our next guest, and then you'll be on for questions, just let me ask you this again, as we've talked about this over time. The equation that you look at, Dr. Raymond, you and your peers, to determine whether or not the curve, in a sense, has been bent and it's coming back down. Can you just explain that for us briefly?
Yeah, it's a very simple concept. We take the previous 5 days of doubling rates and then plug that into the best fit line to get what we would call the best fit doubling time. And the reason we chose 5 days, again, is there are reporting artifacts over the weekend. And we still don't have a lot of numbers here. So a few cases that are reported slow or a few variables in a day might have an impact that we don't want to overinterpret. So every single day we'll be updating you on the average growth rate for the previous 5 days.
Great, and then one other quick question. I noticed this weekend when I was out doing some necessity shopping that there were more people wearing masks. You give us kind of the health view of that?
Yes, Tim, and I think that's changing. As a scientist, I would say there's no good evidence that wearing a standard surgical mask out in the community protects you from the typical viral illnesses. On the other hand, I think the severity of the COVID-19 pandemic here and the terrible morbidity and mortality that we're experiencing, I believe that the CDC is probably going to change their recommendations in the coming weeks. And the Chinese CDC has already said that we should be wearing masks. So I would say that conventional wisdom is going to change, and there will be recommendations very likely for people to at least wear surgical masks. And I would say that absolutely on the front lines of healthcare, but as you think about your employees and the contacts that they have and the difficulty they may be experiencing with social and physical distancing, that might be a good intervention.
Great. Thank you, Dr. Raymond, and I know you're going to stick around for questions. We're going to pivot here a bit from the health update to talk a little bit about, an update on the economic impact. And clearly, Congress has been busy during this time. And I'm bringing on with us Steve Baas, who's our Senior Vice President of Governmental Affairs. And Steve has been closely following all the public policy issues surrounding the corona crisis, or the COVID crisis. And Steve, it's what sits with me is the speed at which both the COVID virus has hit us, as well as the response from a governmental level. I was just looking back in 2008, we were 80 weeks into the financial crisis before the Troubled Asset Relief Program, or TARP, passed. Here's 2020, we're 11 weeks into the coronavirus crisis, and we already have the CARES Act that has passed. And again, as a parallel, in 2008, 80 weeks in, unemployment spiked at 750,000 people filing for unemployment. 10 weeks in to COVID in 2020, and unemployment has spiked at 3.28 million. So clearly a difference between 08 and this crisis. So what can you tell us about the CARES Act and what's coming down the path?
Well, you're right, Tim. It certainly has been a flurry of activity. And the thing you have to realize with the CARES Act is that's not even the first emergency legislation that Congress passed. There was the Family and Medical Leave and Paid Sick Leave Act that passed a week previous. So things are moving at an awfully quick rate. And of course, last week in the CARES Act, you had a sweeping $2 trillion stimulus package that was passed in a big hurry in hopes of minimizing the negative impact of the economic disruption caused by the virus. And the bill really did try to cover the waterfront in terms of what that financial assistance would do and what kind of programs are out there. I mean, just for instance, if you're a sick employee, there's a program for that. If you're a business that's been shut down, there's a program for that. If you're a business staying open and trying to meet payroll, there's a program for that. If you're a business that had to lay off people or furlough them, program for that. If you can't pay your mortgage or your student loans, there's a program in there for that. If you're an independent contractor, you're covered in this bill. The bill's so comprehensive and moves so fast that even if you're an individual who has in no way been impacted by the coronavirus, there's $1,200 of straight up cash in there for you. So it's quite stunning in both the dollar figure and the scope. And I guess, Tim, if that's the good news about the bill, if you want to look at it as good news, having a lot of programs available, here's the bad news. The bill is still going to be running kind of a Hoover Dam sized amount of federal cash through a garden hose sized delivery system. So I think everybody needs to realize we're going to need a unique combination of patience and persistence as we access these new programs and tap into the new aid. I mean, the cold hard facts for some of our small and medium businesses are that, one, the processes at the Small Business Association and bank level are still complicated, and no matter how much they try and streamline it, a lot of our small businesses will struggle to have the skills and resources to navigate it. And second, even at its smoothest, there's going to be a time lag between being eligible for aid and getting aid. And so some businesses on tight margins are going to have a hard time keeping their head above water during that lag. So I mean, I don't want to be a Debbie Downer here, but the sooner you act to get your company, your employees in the pipeline for these new programs, the better off you're going to be. The kind of record spikes that we saw in unemployment last week are going to be mirrored in the coming weeks in terms of loan applications, disaster assistance, tax referrals. Again, you're going to need a combination of patience and persistence to take advantage of the bucket loads of aid out there. One final note, just like CARES wasn't the first legislation on the federal level in terms of emergency assistance, depending on the trajectory of the virus's spread, we actually could see another round of stimulus at the federal level this summer. And in addition, the governor and the state legislature right now are working on legislation of how to use the approximately $2 billion in new federal funds they'll be receiving in emergency aid. And the city of Milwaukee and Milwaukee County will see each over $100 million each in new federal funds to deal with the local impacts of the virus. So we got a lot of work to do. We'll be working with officials on all these levels to provide business inputs on ways we can wisely spend this money to make sure that our region returns to full economic health, even as our population to full physical health. So I mean, that's kind of a 30,000 foot look at it, but I guess I'll toss it back to follow-up questions.
Sure, Steve, do you expect and will both the local response and the state response require legislation, or does it pass through?
Some things are pass-through aids, but a lot of it will require state legislation. Some of these things are funding existing programs and juicing up existing programs. But a lot of it will require enabling legislation, and the governor and the legislature are working on that right now. The governor released some proposals on Friday afternoon that he was making his suggestions to the legislature. The legislature has been working on some things in terms of business stimulus, tax stimulus, and aid to individuals as well. Some things can be done by administrative action. Some things are going to need statutory change.
Good. So, Steve and Dr. Raymonds, we'll see if there are any questions that we can tap here in the remaining time that we have, so we get people an efficient response here?
Yeah, we did have some questions from the audience. Our first is from Ralph, and it's for Dr. Raymond. Dr. Raymond, I don't know if you're familiar with an LA Times story that came out recently about a church choir that had a practice where they were very careful to physically distance themselves from one another. They all used their own equipment, and still a lot of them got sick. Question from Ralph is, what does that say about sort of the nature of how this spreads, even through respiration?
It's a great question, and one of the things that I read in that that article was that they actually shared oranges. So it's possible that maybe through touching and eating the oranges, even though they tried to maintain a proper distance, that could have been the reason, or it could just mean it can spread by close respiratory contact. Very troubling, obviously. But I really did read with interest the sort of offhanded comment that they had shared some oranges. So that may have been how they all got the COVID-19.
We have another medical question in the audience from Sierran. We see a large number of people sewing their own homemade fabric masks. How effective are these masks, and will they protect you at all?
They're probably not as effective as regular surgical masks, but they're certainly better than nothing. And I would say that if healthcare providers run out of the typical surgical masks, even the CDC said that that is better than not having a mask. I would also say just the psychological benefit to the individual for maybe feeling some measure of protection. In the example that they're setting in the community is a reminder that we need to be very careful about social distancing. I think those send good messages.
Yeah, and a similar related questions, who do you think at this point should be wearing a mask?
Well, first and foremost, I think healthcare providers at the very front lines need to wear the masks, first and foremost, so that they don't spread the illness to other patients. But second of all, we need them to be well, especially if there's a surge. So I would say frontline healthcare providers first. One of the things that really troubles me when I'm out doing my essential business in the community is I see a lot of people that maybe can't practice the social distancing as well as we'd like them to. People that are handing your groceries to you at curbside pickup, people working in restaurants for their curbside pickup, sanitation workers, postal workers. I am concerned about them, and my own personal belief is that we should be getting masks. If we're going to have them in the general public, we need to get them first to the people that are interacting with the public in meaningful ways, and maybe even on your work sites.
Thank you, Dr. Raymond. One last question we had from an audience member through email was the explanation of CDC numbers, whether those are total number of people who get infected with the virus or just of critically ill patients, or do we sort of not know at this point?
I'd have to see the numbers that the questioner was referring to, but all those numbers are provided pretty much every day. We almost have information overload, and that's why what the MMAC is trying to do is just give you a couple of simple metrics to follow every day.
All right, I'll hand it back to Tim. Thank you.
Good. Dr. Raymond, Steve, thanks very much for the update. Again, we'll be on tomorrow at 3:30, and we will have an update on both the health perspective and then a little insights in some of the employment law and HR issues that companies and individuals are facing during this COVID crisis. So again, our thanks to Dr. Raymond and the Medical College for providing this very real-time update, which again, we'll do every day at 3:30. Thank you. Have a good afternoon.